Twanya. A lot of people call me Lady T. They know me as Lady T for our singing. But I'm coming to you live on a different note today or this evening tonight. I just had a total knee replacement revision. Um, it's been almost 2 years since I had the total knee replacement done. Um, I was dealing with a lot of pain. Um, where like if I would go to step down off the curb, it felt like bone on bone pain on the inside of my knee, my left knee, um, and be right below my knee. Um, and it got to the point where when it would happen, it bring tears to my eyes. So it was as if I was feeling. It was as if it was bone on bone rubbing, again pain that I was feeling. Um, I'm actually post op 3 weeks as of Wednesday, so 3 weeks and 2 days actually. And it's actually doing it again, which means I'm like, okay, maybe I got to give surgery a little time to work. Why is this happening again? But I'm also having problems with the IT band. Has made it feel like I have bursitis on the left side, outer thigh. Um, is sore, like really, really inflamed. And so, but the therapist that I have has pushed me, God knows, to the limit, and which is good. She's doing her job. I've had her for all my knee surgeries. I also have the same outpatient knee therapy person. Um, Once I start outpatient therapy, they've been awesome. They have done a tremendous job. I would recommend these two to anyone because they know what they're doing. They do what they have to do, and that's it. Um, 2 weeks after I had the replacement done, I was at least 100 range of motion, bending. Um, Day before yesterday, I was having serious problems with the IT band and having serious knee pain to the point if I don't have to take the medicine, I don't. I take it when I need to, but sometimes it gets a little overwhelming when I take the medicine and it's a little late to try to get on top of it, which means I have a hard time getting on top of it. I also suffer with intercostal neuralgia. I also have had several back surgeries. I deal with the sacroiliac joint pain a lot, especially on the right side. Um, so the knee replacement surgeries that I have had, I have a partial in the right knee, and the left knee I just had a revision. Um, I ended up on pain medicine, seeing a pain doctor because of the neuralgia. They couldn't control it. And if I don't take the pain medicine, you can best believe it would allow me, it'll let me know that I have not taken it because the neuralgia goes into rare form to the point I have to go to ER and let them do it. So, which is something I don't like doing because they make you feel like you're a drug addict or like as if you're seeking for medication. Why would I be seeking for medication if I have the medication and has taken it? And I just it did not. I couldn't jump on top of it. Most of the people that the doctors know in the ER, if they know that person, they know that person is not seeking for meds. Some new doctors don't know that. So, but it's not a good feeling either way. Um, as I said before, the incision has looked well. I've not had any problems with the incision. The strips are falling off, some of them. This is what the incision is looking like now. I guess once all of the dead skin and stuff from the staples and the that's just what you call it, betadine. Once the strips fall, the rest of the strips fall off once I get in the shower. Now, also, I have been dealing with RSD, where like if you take your hand and if you go over your knee, it grows hair on it, and like um, to like rub your hand over top of it. It makes it so sensitive. The nerve roots are so sensitive till it hurts so bad. I found that mixing turmeric, the seasoning turmeric, with oil, and I take and put it beside the incision on the sensitive part, for the RSD, and that has helped a whole lot. You'd be surprised what seasonings will do for the body. God knows. Some of the seasons we use in our cabinet works wonders. And so that's what I've been using to try to keep the RSD under control so it wouldn't hurt so bad. But if there's anybody out there that has been dealing with intercostal neuralgia and no other treatment besides pain pills that has worked for them, feel free to leave a comment. Let me know what you've tried. Let me know what you and your doctor have done. Because, I mean, like I've tried injections, and when they did the injections, it made it like rough to the point I had to end up being admitted for a few days because it set the neuralgia off really bad. But also, like I said, I'm dealing with the knee replacement recovery. So I'm dealing with that also. So leave a comment if you like this video explaining, maybe you've been through the same thing or going through the same thing. Feel free to leave a message. I feel like that when you have people that's going through the same thing, you could do something to help someone else in that process that could be going through that process and didn't have anyone to talk to, or besides their doctor, or some things they don't know, the doctors don't tell you to do, they don't know of. So that's how you become helpful to someone else that's going through the same things. So have a great evening. If you like the video and you like the subjects that I've touched, leave a comment, hit the like button. And, if there's anything that I can help someone with that I've been through with this, in the process of all of this, I have no problems with you asking questions. Feel free to ask questions because that's how people get help from each other. So have a good evening. Well, I don't know if it's going to be evening or day or whenever you watch this video. Hit the like button, the like button if you like the video, and leave a message. Have a good evening. Bye.